So thank you to Dr. Zager and to Delcath and OMF for having me come speak today. So my name is Sabrina Frey. I'm from Madison, Wisconsin, and I'm a mom to 4 little boys. I'm a sister, I'm a friend, and I also have metastatic ocular melanoma. So I was diagnosed in January of 2013. And like many of us, I had been completely asymptomatic till about 3 days before I started having some flashing in my right eye. And yes, everybody asked me, I had been getting dilated yearly exams, so it was not something that, this is my second primary. I also had skin melanoma when I was 24. So I was very well aware of, making sure that get my skin checked and my eyes checked and everything checked. So went in on a cold Tuesday in Madison, and on exam, they told me at 8:50 or 10:15 in the morning, you have a melanoma in your eye. It was a small to medium melanoma, 9.6 millimeters across, 4 millimeters deep. I was a class 2. It was a class 2 tumor. So I did know that, I probably would get Mets. So what do you do when you're diagnosed with cancer? Just like all of us. Once I got through the first few sleepless weeks or months, I should say, got through my brachytherapy, got through my first set of scans to ensure that cancer hadn't spread, just the agony of a cancer diagnosis, not knowing what's going to happen. I decided to make it my mission, and my mission was that I was going to learn everything that I could about cancer, because I had a 70 to 80% chance of getting Mets, and so I was well prepared when in July of 2014, my scan did show a lesion on my liver. Retrospective scans showed that actually the lesions were there in April of 2014. And people say, gosh, aren't you just annoyed that you didn't know? And I'm like, actually, I'm really grateful I didn't know. The tumors have to be big enough so they can be biopsied. Mine wouldn't have been big enough to be biopsied. So I was given 3 extra months not to worry. July of 2014, I had a wedge resection, was deemed NED for about 3 months, had 4 rounds of Yervoy, kept me stable for about 9 months, and then summer of 2015, I had innumerable tumors on my liver. During this time, I have to say, it was my mission to make sure that I could get as much information about this disease as I could. I have the most amazing team in the whole wide world, so I have to say that too. I have my oncologist at the University of Wisconsin, Madison, Mark Albertini, he's amazing. I've been, in constant contact with Dr. Sato and Orloff at the Metastatic Uveal Melanoma Program, thank you very much, and Thomas Jefferson. And this year, after lots of treatments, I decided to explore the option of PHP. So again, this is my mission. I'm pounding the pavement. I'm always looking for the next thing. I had to go back and look at my emails because I couldn't remember exactly when it was that I reached out to Dr. Zager. So it was December 9th of last year. I found on a Facebook message board that Dr. Zager was doing PHPs down here. And I was doing immunoembolizations at the time, so I didn't really need to change my treatments, but I'm always looking for the next thing just in case. So I emailed him at, what time was it? It was about 11:14 in the morning. I emailed Dr. Zager. I found his email address, and I was like, I really need to talk to you. About 5 minutes later, he calls me on my cell phone, and we had a great conversation. He said, hey, what you're doing right now sounds like it's working. You have my number. I just called you from my cell phone. If it stops working, give me a call, and we'll see if we can do something. So fast forward a couple months, and I had some disease progression, and I gave Dr. Zager a call, and I decided to explore the option of PHP. He said, come down next week, and we'll chat and see if it's something that might help you. So, in full disclosure, I'm not on the trial because I've been so heavily treated with lots and lots of different things. I'm actually a compassionate user. It's not FDA approved, but the FDA said, yes, you can go ahead and do it. Delcath, thank you, was nice enough to let me use their proprietary filter, and my insurance said they would pay for it. And I said, you know what, I'm gonna give this a shot. So in March of this year, I did have my first treatment. Dr. Zager told me I would feel like I was run over by a truck. I felt like I was run over by 3 semis and then backed over a couple times. So just to put it in perspective, it was like the worst influenza feeling. No real physical pain, but right after my treatment for the first 12 to 36 hours, I really did feel bad. The great part is that in between my treatments, so I've had 3. I'm set up for my next one on Tuesday. My quality of life has been fabulous. And right now I probably have less tumor in my liver than I did about 9 months ago, which is, I can't ask for anything more than that. So, I talk to a lot of patients about my experience. I've had a very positive experience with it. I've responded well. I'm, otherwise healthy besides the liver cancer, which I kind of joke about. When I was first diagnosed, my youngest was 5 years old. I was 39, he was 5, I turned 40, his birthday's the day after mine, so I turned 40 and he turned 6 the day after I did, and I said, I just gotta get 12 more years. I've gotta get 12 more years so I can see my baby graduate from high school. And, and thanks in large part to my team. I'm continually on this mission, my team of doctors, Dr. Zager, Drs. Sato and Orloff, Dr. Albertini, I'm winning the battle right now. And it's, I've gotten 3.5 years under my belt, and I only need 8.5 more, the rest will be frosting. If we had the answer, everybody would be in line doing it. There is no wrong answer. We're just all trying to find a way to survive, to, get treatment, to, get as much time as we can. There's nothing glamorous about stage 4 cancer. It's grueling, it's painful, it's exhausting, it's expensive. Right now I'm traveling every 8 weeks. For 10 days I'm gone from my children. It sucks, but at the same time, what is my alternative? I'm getting really, really, really great time, and I'm really, really, really grateful for that. So I think that's really all I have to say. If anybody has any questions? Yeah.
Does how bad do you feel after each treatment vary, or is the same now that you've experienced it? Can you process it differently?
The first one I had was, I would say the way I felt was so I had it on a Tuesday, it felt really bad for about 2 or 3 days, but I went out to dinner on Friday night, and over the weekend relaxed, and then was able to fly back to Madison on Monday. The second treatment, I only spent 1 night in the ICU, and actually I was discharged the next day because I was doing so well. This last treatment I actually had some minor complications with some platelet issues that we're going to take care of next time. So I had to be on bed rest for 3 days versus like 12 hours, and that was a little tough. But again, once the catheters were pulled and I was able to get up and start eating, I get lots of nausea. So when we're able to control that, it helps me a lot. Again, the curve is really, really steep. So once I get better, I'm like feeling awesome. But when you're in the ICU and you feel terrible, you're like, I tell Dr. Zager every time, I'm not doing this again. And then by Monday, I'm like, okay, put me on your calendar. So it's like kind of like childbirth. I had 4 sons. Every time I had a baby, I was like, no more. And then I was like, after a couple of months, I was like, I think I could do this again. 3 days, yep, 2 or 3 nights. Yep. The second time I was actually only in the ICU for 1 night, and then I got discharged to go back to the hotel. Yeah, and then went back and got my Neulasta shot. Yeah, so it just depends how you're feeling, how your blood counts are. I've responded really, really well, and have felt really, really good for the most part. Yeah. So I've been. Thank you. I've been really, really lucky. So, yeah. If anybody has any questions, you're welcome to ask me about it after we're done here. And great, thank you.